Gas prices in Northern Ontario have been an issue for years, especially gas. The differences in gas prices, even in my riding, sometimes there's 20 cents difference. People are really frustrated, especially because most of our areas don't have any public transit, so the only way you're going to get to a job or get to the hospital or take your kids to skating or to hockey is with a car. That's why it's so frustrating. There's all kinds of people who've tried to come up with all kinds of explanations, and none of them are that credible. That's why the NDP, we've proposed to regulate gas prices so people at least know how much they're going to be paying in the next week. They will know they won't shoot up on a holiday weekend. It's an issue that's not just specific to Northern Ontario, but it's one that really hurts when you have to go to the gas tank for everything. Ontario Energy Board has the ability to regulate gas prices. In several provinces, gas prices are regulated. And in many parts of the United States. The flip side to regulation is that in some parts of the province, if you regulate gas prices, the prices will go up. But in Northern Ontario, where gas prices are already incredibly high, then our gas prices would go down. Driving on our roads is a major concern for people in Northern Ontario, especially in the wintertime. I've heard over and over from people who are afraid to drive, they're afraid to be on our highways. Professional people doctors who don't come here for clinics in the wintertime because they're afraid of our roads. And that's just something that shouldn't be. Safety on the highway is a complicated issue, and it's not just one thing or another thing. But what we've concentrated on since being elected 6 years ago is specifically road maintenance, and that's an issue. Specifically winter road maintenance. We've pushed hard. We created a Northern Road Report. That made a difference. We made a report to the Auditor General. We believe that made a difference. And as a result of our work and others, there has been changes. But we're still got a long ways to go. One of the issues is the privatization of road maintenance. And that's changed. It's fully private now, including actually the road monitoring and who decides when to put the equipment. And that's the first thing to change. That should be changed. We don't believe that privatization is good in many essential services, but you can't buy the whole system back in one shot. But the thing that we have to change first is who makes the call on when the equipment goes out. Should be his or her first duty should be to make the road safe, not whether or not it's going to be profitable that day. So that's the first thing that we need to change. The second thing, it's a bit longer term, on places where multiple accidents have occurred that are high risk areas, we need to, the government, and hopefully someday we, needs to look at these areas, study them, re-engineer the roads, and fix them. We've pushed the government to do that. The government has committed to look at the Pan Lake corner. We're going to continue to push to make sure they look at that, and those places need to be fixed. The third thing, and more long term, is the highway. We need to build more capacity. So there's still a debate going on whether that should be 4-lane. There's a group in the riding now who are pushing 2+1. That's basically continuous passing lanes with the median. That's a great idea. It's something we haven't heard before, and they're doing a lot of work on it. And I think that is, they're talking about doing trying to convince the Ministry of Transport to do a pilot project, I believe 20 or 25 kilometers, to see if this would really reduce the accidents. And if it does, it would be a good first step to making our roads safer. What we've committed to do with the Northlander is we are committed to give ONTC the tools to bring back train service to Northern Ontario, train service that works. We want it to be integrated with the bus service, so buses actually bring people to the train and reconnect people in the north to the rest of the province. For those of you who haven't heard and are interested, the next provincial election is going to be on June 7th or before. Election dates in Ontario are set, and the date is June 7th, 4 years from the last election. But the Premier Wynne, has the power to call it any time before then. So it's like, in my opinion, it's likely going to be June 7th, but it could be any time before then. I've been nominated, so I'm very proud to be running again. We've worked hard on the last 2 terms, and hopefully you will give me your support to represent you once again in Queen's Park. Healthcare is one of the biggest issues in the province. It's actually the biggest budget issue in the provincial budget. And overall, we're all proud of the public healthcare system we have in Canada. Like when you go to a hospital, or you go, the first thing in some other countries, including the United States, the first thing they ask you for is your credit card. We're not like that here. So don't get me wrong, the healthcare system here, the basis of the healthcare system here is good. We have had lots of complaints about, in other parts of the province, about people being treated in hallways, lack of hospital beds, and here, not so much that, but that you have to wait a long time in ER, and you have to wait a long time for services, and quite frankly, it's because, specifically in the case of hospitals, their budgets have been frozen for years and years and years. Now in the last budget, they've been given a little bit more, but they're still behind the 8 ball because they've been frozen for years and years and years. So the people who work in those facilities are doing everything they can to provide the service that they need to provide. But cracks are starting to show up, quite frankly, because they haven't had the funding they've needed. So in some cases, the numbers of staff has been cut, the numbers of beds they've been being paid for is cut, but in some of these hospitals, they don't actually cut the number of beds. So you could have a 100-bed hospital that's actually got 110 beds, because the people working there know they need to service that many people, but they're only getting paid for 100 because the Minister of Health will only fund 100. And that's why you're starting to see cracks in the system. And as well, the government has tried to focus more on keeping people in their homes, because that's where people want to be. And that's a great talking point. And the government has made some steps in the right direction, but they've done a lot more announcing than they actually have done funding. So, for home care, for a lot of people, it's not working. And even for people who are working in the home care sector, so if you're a PSW and you talk to PSWs and they're given their schedule, in some cases they've only got like 15 minutes to come to someone's home and get them ready to start their day, and then they have to be gone. Well, even for young, able-bodied people, you can't get ready. You can't get yourself ready for the day in 15 minutes. So if you're older or if you're incapacitated in some way, how is that ever going to work? So we need to take a long look at how we do that, and there's got to be ways to make the sectors work together more closely, so that we're not running beside each other, that we're all working together in the same way.